Hi, I'm Dr. Regina Moore, and I am a psychedelic pharmacist.
My name is Kristen Spear. I am a member of the Psychedelic Pharmacists Association, as well as a co-founder and member of the board of directors.
Hey, my name is Saad, and I'm a pharmacy manager based out of Pittsburgh, Pennsylvania. I helped co-found the Psychedelic Pharmacists Association and serve as a board director to it.
My name is Kevin Lanzo, and I serve as president and a co-founder of the Psychedelic Pharmacists Association.
Hello, my name is Ann Berg. I'm a consultant pharmacist.
Hi, my name is Sarah. I'm a fourth-year pharmacy student.
Hi, my name is Mary Hornick, and I am an assistant professor in the College of Science, Health, and Pharmacy at Roosevelt University.
Hi, my name is Katie Simons. I'm the owner and operator of the Holistic Apothic, which is a container for psychedelic and medication integration.
Happy Bicycle Day! I'm Dr. Blair Thielemeyer from the Pharmapreneur Academy.
Hi, my name's April. I'm a clinical pharmacist and I'm passionate about psychedelics.
Psychedelics are a powerful form of medicine and they're being reevaluated by the FDA.
And now that psychedelics are beginning to become legalized, I believe pharmacists are a key component and should be involved in using these new therapies.
Pharmacists are the most accessible healthcare professional.
One of the things that interests me the most for pharmacists is how we can continue to inform the patients that we deal with on a daily basis to how to best manage their own health and wellness.
One of the things I do related to psychedelics as a pharmacist is consult and educate on ketamine.
When it comes to education about drugs, pharmacists are second to none in their knowledge and ability to communicate well.
This allows pharmacists to essentially be another set of eyes in the community and work with other clinicians that want to do psychedelic-assisted therapy.
We are in our communities managing medications, risks of medications, informing and educating patients and other stakeholders about medications.
All of these things can be transferable to the continuum of psychedelic care.
From advising on drug-drug interactions to taper or not to taper.
We're seen as a vital and trusted community resource, and people are going to keep coming to us with questions.
Pharmacists are a resource for drug information. They can also be a resource for harm reduction.
I inform patients and families and providers how to dose ketamine for different off-label psychiatric indications based on available clinical evidence. I also screen for drug-drug interactions and drug-disease interactions, what to monitor for, and where they can get ketamine compounded.
I continue to be an advocate and educator and focus significantly on community building these days.
In community pharmacies, there are pharmacists that have built long-term relationships through follow-ups, building a strong therapeutic alliance, and I believe that this can be applied to the continuum of psychedelic care.
This is a really exciting world of reconnecting mind and body and making healing accessible to everyone.
When it comes to the need for safety and accessibility in the psychedelic ecosystem, pharmacists are poised and well-equipped to be that safe access point to vetted, trusted information as it relates to psychedelic medicine.
Pharmacists are one of the most accessible healthcare professionals.
I vision a lot of different roles that pharmacists can take.
Whether acting as a consultant for psychedelic medicine clinics or providing patient counseling in a community pharmacy, pharmacists are and need to be prepared to be the experts on how to use these medications safely and responsibly.
Pharmacists need to be educators, give guidance to both patients, prescribers, physicians about psychedelics.
Ways I believe that pharmacists will be involved in the future of psychedelics is through the development of new curriculums for teaching about psychedelics, as well as drug policy advocacy.
Supporting positive movement in drug policy so that we can be empathetic and best care for people who use drugs and psychedelics is a major impact that many of us can have quickly.
There's also an opportunity for pharmacists to play a bigger role in development of this new model of treatment.
And I feel that if there is a standard of practice that gets developed, pharmacists can definitely add value to the delivery of mental health care.
And it's my mission to make sure that pharmacists have an opportunity to be involved in these discussions and to have a seat at the table in psychedelic medicine.
As legalization takes place, I believe that it is absolutely imperative to just keep pharmacists in mind.
The Psychedelic Pharmacists Association is the largest group of pharmacists active in and contributing to the psychedelic space. We have forged a path for our members to have their voices heard. We will continue paving the way for pharmacists to positively impact the use of psychedelics in community and medicine.